Cumbria Healthier Community Partnership, launched in June 22, brings together member organisations from business, industry, local authorities, the NHS and others. The focus of the programme is to shrink the gap between the health inequalities in Cumbria by delivering an innovative approach to health and well-being in the workplace and wider community through partnership and collaboration. In the first meeting of the Cumbria Healthier Community Partnership, board members met, including Chair Hazel Blears, to discuss and outline the programme's mission, relevance and potential.
First of all, I think it's absolutely essential. I've looked at the health inequalities that abound in this part of the world, and frankly, for a modern industrialised country in the 21st century, they're absolutely appalling, and that's been happening for many, many years. And I think this is an amazing opportunity to empower ordinary people to take control of their own health, to become happier, fitter, healthier, so that they can enjoy their lives. And if we can tackle some of these deep-seated and long-lasting problems around health, well-being, and close that gap between the people who are better off and have a great healthy lifestyle and the people who are not so lucky, then I think it will be really worthwhile.
So the Community Foundation exists to address disadvantage, and we do that by investing in the local community, into local community organisations. In Barrow, we've got really significant health inequalities, as well as in other parts of the county. We've got capability to bring people and organisations together, and Circular One Health are bringing great capability. We've got key corporate partners involved, and there's an energy and a wish to make a difference.
My role as Head of Public Protection at Barrow Council, Public Protection is a traditional environmental health department. We've managed to establish even greater links with our public health colleagues over the last 2 years, and this project will just be building on that relationship. This programme has the potential of really addressing the health inequalities in our town. In Barrow, you can walk from one area to another, and in the space of 30 minutes, your life expectancy could have been reduced by 13 years.
So this is really relevant to the NHS, and as an acute community provider of services, what this will do, it will allow us to get people earlier into the process. What this means for us is that if we've got that early intervention and people are taking care of their own health, it means that they don't rely on our services as much. And it means that when they do need us, they're not going to need a higher level of treatment. So it means that we can treat them earlier and not be as invasive with them. What will that do? That will mean that services become more available for those that really do need them, and it will reduce our waiting lists, which means that the benefit to society is huge.
I think this programme is important because following on from COVID and the effects of COVID and the realisation of how simple viruses have affected us all, the impact that's had on the NHS and on the workplace, I think this programme is important because we need to learn from that. We need to enable people to take control of their own health. We need to alleviate some of the pressures that are on the NHS at the moment, and we need to bring that to a position where this is accessible not just to the few, but to everybody.
So Circular One Health was born out of making a difference. Making a difference post-COVID is about learning to what the pandemic taught us. The pandemic taught us that if we don't have a proactive and invested health strategy as a world, and we don't have a higher level of health and well-being and a higher level of self-accountability, pandemics like this in the future will present more risk to society. So this is our chance to deliver change here and now and empower people to take responsibility. And in doing so, we support the NHS, we support the economy, we support communities, and we bring the next economy forward through the magic of the world of social prescription, which allows us to deliver a future economy out of delivering on essentially what is society's greatest challenge.
I've always cared passionately about health and well-being, and also about working people and their opportunities in life. And so this programme for me is, it kind of pushes all the right buttons. It's about empowering people, not doing things to people, it's doing it with them, being side by side, but really helping them realise how they can change their life. So, if you're healthy and you're fit and you're happy in your family, those are the things that ordinary people want. And this programme, by screening people for their health and well-being, it'll find out perhaps the things that are not so good, and then it will have practical ways in which people can help themselves become healthier and happier. To be part of a programme like that, it's actually a great privilege, and I think that we will make real and lasting change.